So today we are tackling something that is really exciting with Leslie, both as clinicians, as friends, as parents, how trauma and healing can pass down through generations. So Leslie is a pediatric nurse practitioner. I'm a family nurse practitioner. And between the two of us, we see a lot of different things, more from the adult side for me, more for the pediatric population for Leslie. So we're going to be talking about massive generational shifts in parenting styles. So, Miss Leslie, go ahead, introduce yourself.
Hello, so I am Leslie Alvarez. I've been a pediatric nurse practitioner for, oh my gosh, how many years? Almost 9 years. So I can't believe I'm saying that. So love, love, love working in pediatrics. It's my heart. I think that's probably the main reason why I chose the career I chose is because I love pediatrics, but also at the end of the day, I want to be able to help the kiddos that I see every day that may be dealing with something that I dealt with growing up and knowing like, okay, it's going to be okay, or we can help with this, we can work with this, things like that.
Yeah, absolutely. So something really exciting is when I decided to jet with Leslie and we were going to come up with something exciting to give a platform. I really thought she was going to talk about like vaccinations or clinical pediatric illnesses that we typically see. So it was really exciting for me to hear from you that your heart and your passion, of course, is children. But that you're seeing a lot of mental health concerns. So tell me, because I see it in the adolescents typically now, since I'm dealing with children a little bit more, I'm seeing it there too, but you deal with children for 9 years. So tell me a little bit about the mental health concerns that you're seeing in clinic.
So I will say one of the things when we kind of start off, one of the things that I see in practice, because mind you, I have my own children and they're, almost, my youngest is almost 17. And so that kind of gives me an idea of where their parenting style is coming from when the families come in. And so knowing I'm coming from a background of a parenting style where basically it was, you don't say anything, you don't have an opinion, kind of like you're too young, you can't have an opinion. How would you know something? You can't understand these problems. And so in coming from that, it has changed my parenting style, but it also helps me work towards being able to help these parents change their parenting style. And it's not easy. It's definitely not easy because, you are built into a system where, we are taught what we're taught. So our families teach us what we're speaking, what we're doing, why we do what we do, why we go to the church we go to. And sometimes it's not always the best. And it's important to consider, how can I help these parents understand, and even these teens understand, hey, I know exactly how you feel. I've gone through it or I've dealt with it, and it's still going to be okay. Because unfortunately, sometimes they have a feeling that it's not going to be okay.
Yeah. So being that safe place for them where they can talk about deep, dark secrets, essentially. Have you seen in clinical practice, I'm sure you have, but maybe kind of a loose example of a child that might not have that good connection with the parent, and you are at the safe place now. So it's almost like you're a clinical parent in a way, and they're able to say something that they're not comfortable saying to their parents and how impactful that is for them.
Oh yes, I have had that many times, and these are one of the things that school does not prepare you for. There's a lot of things that school does not prepare you for, the scenarios that you go through, the situations you find yourself in, because that appointment that was a headache appointment turns into many more things. And I know that when my kids were growing up, as far as, I mean, they're still growing, but when they were a little younger, there's a lot of questions that I find myself asking that I felt like their provider never asked. And, it's hard because I think back, why was my kid not asked this? But then I also realize there's a lot of parents that don't want you to ask the questions because they were taught that. They were taught they shouldn't have these questions asked. And so we want to make sure that when our kiddos come in, that number one, they understand this is a safe place. Like, we have to make sure that the parents also understand that our job is to do what's best for these kiddos. And sometimes they may not like what our recommendations are. And I here at the clinic, I have been cursed at and I have been yelled at and I have been, threatened in many ways. And it doesn't matter because I'm going to continue to come back because these kiddos need me. And I think when you can get through to a parent that they can say, man, like maybe I am doing something, in a way that isn't okay. That's kind of when you see that the relationship can get better, but it won't 100% improve.
And I heard you when you were talking about headache. So more from the adolescent perspective and adults, what I'll see is patients will come in, their blood pressure's elevated. They're like, I have migraines, and then we can link it towards stress or something going on at the home. So the kid that's coming to you that booked an appointment for like upset stomach, like they always have tummy complaints, right? You kind of get to the heart of the issue and it's not GI. Do you have instances where that's happened?
Absolutely. I mean, I've had a kid that has come in for, back pain, for example, and I have spent an hour with them in the clinic, just having conversation, and the true concern comes out. And, I understand we live in a world where we're supposed to be quick at our appointments. Like you need to be quick, you need to get in, out, that is unfortunately what healthcare is. And so we want to make sure that we're seeing who needs to be seen. We're wanting to make sure that everybody's taken care of. But if I have a patient that needs me, I am not worried about time. We have an amazing group that I work with, and they will pick up. They will know when I'm struggling with a patient, and I don't even have to ask for them to pick up. They will pull from my schedule because they know that I'm dedicated to helping adolescents with their mental health. And they know not to rush me because I'm doing my very best.
That's wonderful. So things that I'm hearing, you take time if necessary. And this is probably years of not being able to express something that's really important. And I know that we were talking about millennials as cycle breakers and kind of what that means. What I'm finding is a lot of parents will say, I know that the way that I was raised is not a great way. I don't have a great relationship with my mom or dad. Now I'm dealing with boundary issues in adulthood, all of these stressors. And I know that I don't want that for my children. And now it's this unknown of, I know what was done before wasn't the best thing, but now I don't know what to do. But it's exciting that we're seeing like a shift in parenting. Are you noticing this shift when you are seeing pediatric population and parenting maybe 9 years ago versus today?
Oh, yeah. I mean, I've seen a lot of the change, and, COVID didn't help because that was a lot of stress. And so, having to have these families sometimes relearn how to be social and relearn things has been a challenge. But is there change? Yes. Sometimes I think that change that needs to happen is not happening. And sometimes it's blamed on social media and it's blamed on things like that. However, being a millennial is also, I don't think people understand. Like, I am going to be 45 years old next month. Okay. And I had my son young. I was 18 years old when I had my son. My husband and I got married right before I turned 18, okay? My dad, for 2 months, to save 2 months of child support, chose to sign the rights over so he could save 2 months of child support. And so he signed for me to marry my husband. We have still been married. We were married for 27 years. It is rough. But being a millennial, your job is you've got to realize that what you were taught before is not what you need to do now. So my background is, in my family, on both sides of my family, there was unfortunately a lot of sexual abuse and there was a lot of domestic violence and things like that. And so when you're taught that, and that's what you're used to seeing, trying to teach yourself as an adult, that's not okay, number one, and not expose your own children to that, number two, that's challenging because it's basically the whole, like I say, like you're learning how to walk again. There was an article that my cousin, who is a psych nurse practitioner, sent me. That's the psych nurse practitioner. And there was an article that she sent me, and it mentioned how the millennials have the hardest job ever right now because we are going against the grain. So basically, if you're in the river and the current is going, we're used to going with the current. But millennials, unfortunately, are trying to learn how to go against the current. But at the same time, you're also learning how to go with the current correctly to what is appropriate. And then you're at that same moment learning how to, let's say, how to fish. You know what I mean? Like I'm raising my children. I'm trying to get rid of everything I was taught, trying to learn new things to be the best parent that I can possibly be. And it is overwhelming. And, to think that us as millennials don't have our own anxiety or depression or, we're human, we're human too. And it's so important because if we are looked at specifically like in healthcare, people tend to think we come from families of money. Oh my God, she was able to go to NP school, or they were able
Her
to
childhood was awesome.
They had a great childhood, parents loved them, things like that, and I'm like, no, like I come from a broken household. Like at 15 months, my parents divorced. I haven't had a conversation with my dad, okay, in 9 years because I had to cut him off. Why? Because at the end of the day, if it's not good for me, it's not good for my children. And yes, you can have a dad and you can have a mom and you can still appreciate or love who they are from a distance. And it's tough because when you're in that situation, you see, some of these kids that I see here, they don't have mom or dad. I can relate because they may not have mom or dad because mom is gone or mom is, has passed away, or, mom is incarcerated, something like that. But I can still relate with that. And that goes into my care that I provide to these kiddos too, because it's hard being a mom.
It is.
It's so
really
hard.
is. I think that's wonderful. I think that, your upbringing sounds stressful. You can see my movement. I was like, oh God, it sounds stressful. And for kids that have that same stressful dynamic, that might not have that relationship, to be able to feel secure, especially to talk about things that aren't really easy to talk about, is really huge. So I love the fact that you're using, the platform that you have at work as a clinician to be able to meet them where they're at, which isn't always the most safest, healthiest spot, and being able to help them with that. So that is amazing. And I agree. I think being a millennial is really difficult. Like you said, it's like fighting against a current in an already stressful situation. You add all of these other things, and then you add the fun mom stuff like the ballet and the dance and like all the other things that we need to do. I will say I have a therapist. Shout out to my therapist. And what I notice as a clinician on the adult side, patients come to me 40s, 50s, and they're battling boundaries and setting boundaries at 40 and 50. And it's crazy. So it's wonderful to be able to be small and young and know how to set boundaries. So when you're older, you don't have to have as much guilt about going to different events and wearing yourself out. And that's what I'll typically see in where I work is a lot of people, adults, that are working at a job that's very difficult and the work-life balance is low. And they're like, I can't call out today because I'm the only person that's doing this job. But then they're slowly deteriorating. Their blood pressure medications need to, we need to keep adding things. And it's coming from one thing.
Yeah, no, definitely. Boundaries are so important. And, it's no means no, period. There's not a no means no if, no means no when, no is no. And that's one of the biggest things I also tell my kiddos is I'm like, look, you may have said yes before, but you can still start saying no. You can still step in and say, you know what? No, like when we talk about, them being sexually active, that's a big conversation because you will have a lot of adolescents say something like, well, I felt like I had to, or, I didn't really say yes, but I didn't say no. Do you know what I mean? And so that's one of the biggest conversations that we'll have is when you are sexually active, number one, you're doing adult stuff and you're prepared for adult problems if that's what you're going to do. But no means no. And don't ever feel guilty for saying no, whether it be that, whether it be a relationship in your family that is not working out, whether it be a situation where your friendship is not working out, you have to do the best for yourself. You have to protect yourself. Nobody's going to protect you for yourself. Like, you got to do it. And so, I myself, boundary setting and a lot of things, several boundaries that I set is I literally don't talk to very many people of my family. Like, my family, I will tell you, the majority of my family is this clinic, because the providers here, we are always, trying to get together at each other's birthday parties. They came to Ileana's quinceañera, Grace's quinceañera. Like, that's my family. And I have two friends that I really have a conversation with all the time. I have my sister, and then I have my aunt and uncle and 2 or 3 cousins that I do frequently interact with. My grandmother had 10 kids. My mom is not one of the people that I truly have any interaction with. It's just not a good boundary. And I have to meet my mom where she's at. So if my mom is dealing with her own mental health issues, her own traumas that she dealt with, until she's able to process those, she's not going to be able to give me what I need. I'm grateful for being raised. I'm grateful for everything that she has done for me. I am grateful. But we're at an age where we need to understand that things that you did hurt me. And when I tell you that, the answer is not, well, what about me? You know what I mean? Like, we're talking about me. And if you want to tell me what I did to you, then I'm happy to hear that, but not right now, because this is my conversation. And so with my kids, I try to pick up on things that bother them. I obviously can't read their minds. They are teenagers. Sometimes voice bothers them. But, like, I had a situation with my middle kiddo one time where we were driving and her job was to hold the drinks in the back. And first turn, the drink spilled. And so we were joking around with her saying, girl, you had one job. Now, I could see when I said that, it bothered her. She never told me it bothered her, but I could just see the look in her face. And so I knew at that moment I needed to say something. I wasn't going to say something in front of her other sister. But when we got home, we cleaned up everything. And I did have a conversation with her. And I said, look, I saw that it bothered you. I never meant to hurt your feelings. We were joking around with you. And please know that I would never want to do something intentionally to hurt you. And saying you're sorry is like impossible for some people. When you say, I'm sorry I did this, or even going back to the boundaries, like even when someone says, well, I'm sorry I hurt your feelings, in a tone that is not sincere, that's a boundary that maybe you need to set at that moment. Yeah, no, I hurt your feelings, but what did you do to me? And yes. And like, even, in my growing up, we were taught you have to give your aunt and uncle a hug. You have to give so-and-so a hug. You have to go whatever. And I don't do that. I don't raise my kids that way. If you feel that you're connected and you feel like you want to, great. I am not forcing you to hug any one of your aunts and uncles or cousins. I am not forcing you to, have to go interact with them. How do I even know that you're feeling connected? And that's going to be something I'm teaching you, to be forced to go do it. So then you're going to teach your kids, you must go do this. And I don't ever want my kids to feel that, because that is one of the ways that sexual abuse happens. And, when the uncle or the cousin or whoever it is, because it happens so often in families, it winds up being where there was no boundary. There was no ability to say no, because in their eyes, the parents were like forcing them to go say hi. And I don't ever want my girls to feel like they have to do anything at all that they don't want to do.
That's wonderful. I am in agreement with that. And it's such a very small thing, but I feel, especially for Latin communities, it's really hard, because that's how I was raised too. It's like, you're going to walk in this room and you're going to hug everybody and you're going to let everybody know that you're here. And it was something that I had to do. And when you get older, then you start the lines get blurred and it's like, oh, there's an adult. And when I was small, this adult has power over me. And it's this power shift dynamic. And I have to, because they're in this place of power and they're telling me to do something. That means I have to do it, versus what my body wants to do or I may feel comfortable doing. And it's really small. And I feel like a lot of parents don't know that. It's almost like you feel you're guilty. You feel guilty inside that your child's not being respectful. They're being disrespectful if they're not doing that. But it's so important to give that independence about their own body when they're small. So when they're big and they're in more adult situations, it's easier for them to remove themselves from situations where they feel uncomfortable. So that's huge.
Yeah, absolutely. Absolutely. It's so important for them, and I think coming from a Latino family, raised that, our traditional, Catholic faith and our traditional, this is, if you don't do this, you're being disrespectful. And so I don't consider it being disrespectful. That's just not something for me. And I think when we consider a lot of the things culturally that I grew up with are things that now, like, sure, I want to bring some cultural things with me, but there are cultural things that I do not want to bring with me, and it can be something as simple as, growing up, we were always told, oh, you need to get out of bed. You're not depressed. Oh, you just need to go outside. You just need to go get some sunshine. Or the thought that because you're laughing that you are not depressed, or the thought that, these things don't exist, and they've existed. The problem is we've suppressed them. We've suppressed them because we don't want to disappoint our parents. We don't want to disappoint our family. We're considered crazy, or we're being disrespectful. And that's just not something that with my kids. And, my husband, he was born and raised in Mexico, and he struggled at the beginning when we were raising our kids. Like, we did have issues where when we were raising our kids, it was one of those things that became like, hey, I'm trying to teach you what is happening. Maybe when you were growing up in your family, you did not have the opportunities, I guess, to say, to do what some of these kids do, or you didn't struggle with the same things. But that doesn't mean it doesn't exist, because our children are being raised here, and they're being raised in our school districts, in our population. They will have jobs here. I can't raise them the way you were raised in Mexico. I can't do that, because this is the real world. And I do tell my families that. So a lot of my Latino families that I have, when their child comes in for that, that is one of the conversations that I have with them, is I say, look, we are raising our children in a completely different time. We are raising our children in a different, life in general. It's not the same thing. So you cannot continue to raise them in the same manner that you were raised and, feel like you're being the best parent. I tell them to think about, what did you need when you were growing up? If you can just think, what was it that you needed as a child? And consider that. And I'm not talking about materialistic things, financial stuff. I'm talking about, what did you need? And so my brother-in-law, we had this conversation, and I tell him, every single person has a trauma. You cannot tell me. Every single person has some sort of trauma that you cannot forget. You just can't. You know what I mean? No, that's like, I can tell you so many things that the way that I was, brought up, and I, just in general, the way we were disciplined, or we had to go get a stick from outside because we were going to be spanked, or I can remember times that we were walking barefoot on the asphalt because we lost our shoes at the swimming pool, and we were not calm because we were going to get, spanked. And so the conversation I was having with my brother-in-law was, everybody has a trauma. And he was like, no, I don't have any traumas. I had a great childhood. No, you got a trauma. I promise you do. Your trauma is you're denying your trauma. And so one time we were over at their house after that conversation, and he was talking about how he remembers being in the fields planting corn, and that my father-in-law, unfortunately, because that they did what they did growing up, that my father-in-law did not like the way he was planting. And so basically he kicked him, and it pushed him really far away. and he yelled at him. And I said, that's your trauma. That's your trauma. I know it is. And he would tell me no, but it has come up so many times that now he's like, it is my trauma. He talks about it. I'm like, I know it. I know it. But what you're looking for is for your father to apologize. And we have to go back to, my father-in-law is fixing to be 76. He's not apologizing. He's not. He doesn't know how to. He wasn't taught that. So you are going to have to move on. You're going to have to accept the apology that you've never received. And maybe I got through to him. I don't know. Maybe I didn't. But I will say that I was like, see, I told you I had a trauma.
Yeah. Well, you think about it nowadays, like with the millennial shift and the shifts that we're seeing. Let's put it in modern day where that child is maybe cleaning their room and they don't clean it well and they like left a spot or they spilt something in their room and then they get kicked. It's not in the in that setting, but it's in this modern day setting. And maybe the apology will never come. But my hope is that it's such an impactful trauma that he knows how it felt and remembers how horrible that sensation was. And yes, it hurt, but it was embarrassing. It was a lot of internal feelings he had to process as well, that he knows enough now that if that happens in a modern day setting with his own children, he won't respond in that way because he knows how it felt. Not only that it's not a great way to respond as a clinician, but he knows because he was there. What insight would you give for? So I agree. I'm like, yes, yes, yes. Let's say that we have somebody that's listening and they're like, yes, 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 but now what? What would you recommend for people that were like you in the past? My recommendation is if you don't have a resource, therapy is great. If you're like, I know that it needs to change, I don't know how, it's great to talk to your clinicians. Like you can book an appointment with your clinicians, your NPs, your PAs, your MDs. We're all trained in mental health. So even if it doesn't involve a medication and it's an appointment, we can just talk about what's going on and help you be able to get to the root of it. So that way it's not blossoming in your life and kind of taking over. So that's important. Kind of like you spend an hour with this patient that really needed it. But you can book appointments, right? You can like book a mental health appointment to sit and talk about something that's going on, a dynamic shift. And with your training and education and what you see, be able to offer the parent a little bit more support. But if they even need more support than that, I think therapy is a wonderful option. I personally have a therapist. And I know we related it to like buy milk, buy therapy, and it's that same thing. So tell me about that for that parent.
So I like to let parents know, look, this is normal. You are not alone. And in the clinic, I also like to make it a point for them to know that therapy is not for crazy people. Because I do hear that. I do hear that. They're like, yeah, only people are like, oh my gosh, that's for crazy people. When I mention therapy, they're like, oh my gosh, like, am I acting so crazy or something? And it's not that. We need to get stuff out. Like I do therapy, absolutely love therapy. I love my therapist 100%. And I'm always like, can you just come to my house every day after work so we can kind of just, decompress kind of thing? Because there are things that happen that we don't have control of. But when I talk to these parents, I let them know, yes, 100%, this is normal. It is a bad time right now. Like, let's say, so it's a bad day, not a bad life. We're not having, bad life in general. We just need to figure out what we can do. And in treating these kiddos, I'm not a fan of doing medication right away. That is just not something that I like to do because not everybody needs medication. Not everybody is going to like, being on a medication in general because you do have a stigma behind that also. And, we have many wonderful drugs that are meant to help, but I always want to start with therapy. And my focus is the child. And I want to make sure, and our clinic is wonderful because we have our own behavioral health therapist here. And then we also have so many resources outside of it. So let's say that they can't make it in here. Let's find you someone else. But when I'm reading the dynamics, because you learn to read these things, you learn to read the way the kiddo looks at the mom or the dad, or the way the mom looks at the kid, or you learn to read that stuff, and you can pick up on a lot of stuff. And we even try to give resources for the parents to do therapy. Now, I can't force anybody to do anything. All I can do is continue to tell you, like, you need therapy as much as you need bread and milk and eggs. Like, we need that. Then, if in them doing therapy, they feel like they're making a little bit of progress, but not a whole lot, then I'm happy to try a med. But I don't do medication without therapy. So therapy first by yourself. It's not enough, we'll add a med. But if you quit therapy, we can't continue just with a med. That's not how it works. It's not a magic pill. It doesn't magically fix your life. It will not make that boy like you, or that girl that is mean to you be nice to you. It's not going to do that. It's meant for you to slowly be able to process the things that you need with the therapist, with a little bit of help of medication if you need it. And, to be able to feel like you're happy again, to be able to feel like in this life, you want to get up and you want to do stuff. Because, having those kinds of feelings where you're anxious, you're depressed, you just want to be in your room all day, you don't want to get up. We all have days like that. There are days that I'm like, I just want to lay in bed all day. And then your mom brain goes off and you're like, and I got to go move the laundry, and I got to go feed the dogs, and I got to go do, I really don't have that option. But, as teens, we tend to relate, is this teenage behavior, sleeping all the time? Because summer's coming up. So parents will be asking me, why is my kid sleeping all the time? Well, let's consider your teen, first of all. It is summer. They've been going to school all year, and they have the chance to sleep in. Did they stay up till 2 a.m. playing video games? We have a lot of things, And so in considering the whole starting medication, starting, therapy, finding for families what we can find, that is one of the best things that you can get from your clinician. That is one of the best things, because that's our job. I am here to help you be the best person you can be. I'm here to help give you information so that you can be the best parent you can be. And we're not always going to agree on our opinions, because we're raised differently or we've learned differently. But that doesn't mean it won't work for you if I'm suggesting something.
That's wonderful. So now this parent that was like, yeah, I feel gung-ho, we have some tools in the toolkit to give today. Book an appointment with Leslie, with me, with a pediatric clinician, internal med, family med clinician. We can provide you with like a blueprint of what's the best thing for you. Medication may not be it, medication may be, but we'll have that discussion at the appointment to really try to figure that out. So that's great. And then lastly, right, we have these tools in the toolkit, but I feel guilty because, man, you brought up some stuff. I feel guilty the way that I treated my kid. I didn't realize this was a bad thing. And now I feel guilty and a little saddened by it. But I do want to end with the power of repair and how transformative that is, especially when you mentioned, family member that will never get that, but how important and impactful it would be if they did get an apology, and how we can start. Even mentioned apologizing when your daughter spilled the drinks and how that made her feel, and recognizing that and being able to say sorry. From my childhood, it was really hard for my mom to say that to me. I don't remember her ever saying she was sorry for anything. I'm not a perfect parent at all. I say sorry at least once a week, at least, maybe once every other day. I'm doing something that I'm noticing that is not nice, or wow, mommy said that in a really mean voice. That wasn't nice. That was a very, so being able to recognize that, but then take it a step further of apologizing and the power of repair. So yes, you may have been this parent that, you didn't have those tools. You left some trauma behind, and you will continue to leave trauma, little drops here and there, but the power of repair and how that's important, and how you're seeing it within your family and within your clinic. Tell me about the power of repair.
I mean, repairing it in my family, in general, just kind of trying to fix myself. And, yes, nobody's perfect. We always are going to mess up. And that means we're human. It doesn't mean anything's wrong with us. It just means we're human and we're learning creatures. And when I've learned something, you have the choice of continuing to follow what you've learned, or you have the choice to change it. If you were taught bad behaviors, let's figure out how to do something good with it. And, apologizing for me, it was hard at the beginning. I mean, it was hard to be like, oh man, like that wasn't me. I didn't do anything wrong, kind of thing, because I was there. But to know that I have no problem telling my kids I'm sorry, telling my husband I'm sorry. Even when kids will say, back to me, they usually don't say I'm sorry. Their words are, my bad, homie, is what they say to me. And so, I mean, I know that means I'm sorry. And so, fixing it is you fixing it, choosing to fix it in your own family, choosing to start there, choosing to say I'm sorry to my kids, choosing to not yell. Yelling was such a big thing growing up. Stop yelling. It does not help. It does not help. Yelling, if I need to say it again, yelling does help. You are not meant to meet your kid on their same level. If your kid is yelling, it doesn't help for you to yell back, because all you're doing is creating these two giant energies that are fighting against each other, and then it causes more issues. I know some kids that have been physically violent with their parents or vice versa. And so stop yelling. That's a way to repair something. Saying I'm sorry 100% is a way to repair something. Giving your kids the space to come to you and you not judge them. Because a lot of times, with girls, they come home with all kinds of stuff. I don't know. I feel like I know the school, because of what gets said. I'm like, who is this now? What are we talking about? But when my kiddo will ask me something, I say, do you want my opinion or do you just want to vent? What would you like? And sometimes she's like, I just want to vent. Great. I will listen. I have no opinion. I will not say anything about what are you going to do. I literally just say, I'm here. I'm glad you were able to talk to me about it. Sometimes she says, okay, I want your opinion. And then after I give her my opinion, she's like, oh man, I really don't want your opinion anymore. But that's part of it, is being able to have that communication with your kids. And, we're not, like I said, we're not perfect. I'm sure that they're going to have some trauma that they need to go to therapy for from growing up with me. And that's okay. Like, I know that's okay. I know that they understand that therapy is good. I know that they understand that that's part of it. But I don't ever want them to feel like I'm not sorry. If there's anything they need to come to me about and tell me, you made me feel this way, I am absolutely sorry. That was never my intention to make you feel that way. It was not my intention to hurt your feelings. That's what's important when you're trying to repair things.
I think that's wonderful. Kind of helping with the communication. What I've noticed is that since we're starting, and she's 5, so we have a long way to go till 17. I'm excited to know what 17 looks like. But because I'm able to apologize and say, I'm sorry, but also not I'm sorry, but what I was sorry for. That the linkage is so important. I'm really sorry. Mommy shouldn't yell at you. You don't yell at me. I don't yell at you. We don't yell. And when I get frustrated and my voice starts to go up, she'll say, Mommy, remember, you're not supposed to yell. Or it's really making me feel this way when you act this way. And her being able to come to me, because I also want her to know that a person in high standard, like a mom or a dad, we're a collaborative team. We all work together. We all live in the household. We're all kind of shared dynamics. And we all want to feel respected. We all want to feel loved at the end of the day and know that it's a safe place. And if you don't feel that way, then thank you for bringing that to my attention. I'll say, oh gosh, I'm so sorry. I didn't realize that hurt you or that made you feel this way. So that way, when they get older, they're able to deliver effective communication that will help you as a parent get down to some of those little seeds that are planted from other people, peers, people that might be trying to hurt them or manipulate them. So that's so powerful.
Oh, yeah. No, yeah. And I think it's also important that when, you call, like she calls you out and she's like, Mommy, you're yelling. It goes the same way, because I will tell parents, you need to call out the behavior also. So if your child is doing something that you know is not appropriate, you need to call that behavior out. Okay. Don't act like it doesn't exist. Don't act like your kid isn't doing what they're doing, because I do that with my kids. I can sense a change in their tone. I can sense when their voice is, louder. And when we're having a conversation, I say, I don't know who you think you're talking to, but before we have this conversation, do you want to continue with the tone that you're at, or do you want to reassess that? And then they'll kind of be like, oh, like I realize that maybe, I'm saying something, because call out that behavior. I'm not yelling at them. I'm not just, first of all, like, let me just let you know this is what I'm hearing. But also when I'm having that conversation with them, because they are venting and I am calling out that behavior, I also want people to know that one of the biggest lessons that I've learned in nursing school initially with my psych rotation provider, Mrs. Estrada, absolutely love her. Yes, yes. So, I love her. And I'm sure she's out there doing her fancy NP work somewhere. But we were taught, don't ask the question why when you're talking to your kids and you're repairing. Don't ask why. Why did you do that? Why did you say that? Why did you go here? Why is a shutdown word? That is a shutdown question. If you say why, we immediately go into defense. Well, why did you, whatever? And it makes you question who you are. Rephrase your questions. Tell me what made you feel like you needed to say that. Or is there something that made you feel like you needed to act that way? Those are important things, because why did you do that's not going to help. That's going to shut down your relationship and your repair that you've done.
It's more reactive. And then they withdraw. And the way that they felt, because as a parent, it's important for them to know they can act however they want to act. We're going to be here to help navigate that and redirect it, because it's a lot of energy. Yeah, like I said, I have 5-year-old explosive tantrums. It's a lot of energy, but let's redirect the energy. But if they're scared to act a certain way because they're going to get hit, yelled at, put in a timeout for who knows, it makes them not want to talk to you, communicate in a way. So it's great. Presence is great. The ability to sit and like you said, let's not yell. You're not going to talk to me like that. I'm not going to allow you to speak to me that way. Let's see what we can come up with together. It's collaborative. And then it helps with self-awareness. So they're able to see that was a trigger for me. So maybe in the future when I'm interacting with a teacher or someone in the workplace, I know that we're not going to match energies, because you do see that behaviorism within the workplace. You hear about it. I've seen it in the workplace. I'm like, wow, we're matching energies and we're throwing hands. They call it throwing hands. Throwing hands. And why are we getting there? So if we really talk about it early and give them the tools that children need to communicate better, the communication is so much, and you actually resolve the issue instead of putting it down and pushing it down or being explosive and losing your job.
Yeah. Well, and even with parents being explosive with their children, we don't come to work and say, I want to call CPS today on somebody. We don't do that. Just like I say, no one ever goes and says in high school, I want to grow up to be a houseless person. I want to grow up to be a drug addict. Unfortunately, that's not, the case. Some people do wind up in that situation, but nobody ever says, I feel like making somebody mad today, so I'm going to call CPS. However, at the end of the day, in my job and what I do every day with my children, with the patients I see, my job is for your child. And you may not agree with what I see. However, there are situations that I do have to do that. But once again, if people knew how much goes into making a CPS report, they would understand. We don't. I mean, as reporters and, and in healthcare, yes, we are mandated reporters. If I see something, I have to report it. And even with educators are mandated reporters. Now, I know they have 30 kids in the room all at one time, driving them crazy kind of thing sometimes, especially if you're in the high school. God bless you if you are in the high school. I subbed in the high school for 2 weeks before I went into nursing school. I was like, absolutely not. I can't do this. So, CPS is there to protect your kid just as much as what we want to do. And we have to report what we need to report, because if we don't, we're failing your child.
Absolutely.
And that's not.
It's the safety of the child is above everything else. It's above personality conflicts. It's above feelings. The safety of the child goes above everything else. We're still a safe place. At the end of the day, even if we do call CPS, we think you're great people underneath, but we do have a responsibility to the state and to the child to be able to initiate that. And if we feel like the child has, consequences that could be detrimental for them, then we have to, we're obligated. But we do want you to come to us. We are approachable, we're warm, we're helpful. And like Leslie said, we don't want to sit on the phone for hours. It really does take up time. You have to reschedule patients and move things around. I've been in that situation, and it is not a fun situation to be in, but it is for the safety of the child.
Absolutely. Because, at the end of the day, that is our job. I want the best for all of you, but at the end of the day, my responsibility is also for your child. And that's what we want. We want them to be safe. We want them to be, growing up in a great environment. And we're not always going to have that. They're going to be teens and they're going to be acting crazy and stuff. But that doesn't take away from what my responsibility is. Whether you are a newborn baby or whether you're an 18-year-old patient that I'm going to see, it doesn't matter. And I mean, when we talk about the personality conflict, sometimes I have parents that have told me before, I never want to see you again. I'm sorry, I had that. And they will still bring their child to me. And so it's kind of interesting because I'm like, maybe they reflected on the conversation that we had that at the moment they didn't care to hear. Maybe they reflected on that and maybe they took something from it. Or maybe they forgot it was me. I don't know. But
I've had that happen before too. And then they keep scheduling. I'm like, you told me you don't like me.
I was like, I thought you.
But that's okay. I'm here for you. Because at the end of the day, no matter what the personality is, no matter what the feelings are, we're here for you. As clinicians, that's our duty. That's our obligation. That's what we signed up for. So we'll always come in with a warm smile and a helpful attitude. Even if at the last appointment, it was more like, we will approach it in a great way moving forward. So never feel like you have to reschedule because you feel like the warmth wasn't there. Of course, we want you to schedule with someone you feel confident and happy with. Absolutely. If you're not going to be able to connect with me, then you're not going to be able to talk about things that are important to you, which is important for us to figure things out. But at the same time, never feel like because the way that you acted is going to hold my ability to take care of you, no matter what. So we brought a lot of wonderful insights forward. We brought your personal family history, which is huge, forward, how you're able to connect and help with the dynamic. We brought the power of repair and how important that is, and the boundary setting, what that means, teaching your kids how to interact in small situations. So when they get in big situations, they're able to navigate better. So we talked about so many different things. And you can take a moment, but if you had to end with a sentence for that parent that's listening, that's really thinking about resources or changing their parenting style because of what they're hearing today, what sentence would you have for them?
I would say one of the biggest things is don't feel like you don't have resources, because we have them. There's so many resources available, not only for children, but for families. And if you're struggling with yourself, for example, like I don't have health insurance, let's say, we can help you, but I cannot help you if you do not tell me what you need. I need you to tell me what you need. I'm here for you. And if we're failing at giving you those resources, then we're failing everybody. We have we need to take advantage of them. We're here for you.
I love it. So my end statement is there is no perfect parent. There isn't. And I know people are watching and they're like, oh gosh, you guys have to be perfect parents. I mean, look, you guys are in figs. You have your name, like you have clinical experience. You studied, you know the anatomy of the brain and how it works. But there's no perfect parent. There's no manual. There's nothing that's gonna, tell you step by step what to do to be the perfect parent. But we try every day. And what I'm seeing across different Latino communities, other communities in the world, different states, different countries, is we all want the best thing for our children. And if we're able to rise above the sensation of fear, insecurity, doubt, and be able to use those resources, I think you're going to do great. Great things are going to come for you and for your child.
Absolutely.
So thank you so much, Leslie, for coming and sharing your experiences and what you're seeing in the clinical setting. And I'm so excited that we got to collaborate and work together on this because it is so meaningful for me to see, but also in your clinical practice. So thank you for sharing time with us.